Thank you so much, and thank you for inviting me. It's a great pleasure to be here with all of you today. Europa Donna is, of course, a collaborating partner in this unique European Partnership for Action on Cancer. But before starting, today I'm going to be talking about our prevention program. Europa Donna is, of course, the European Coalition for Breast Cancer. I'd like to say that it's also a privilege and an opportunity to be in the room with so many representatives of the Commission, of the cancer leagues, of various national health ministries, many NGOs and other organizations across Europe. I say it's an opportunity because I'd like you to watch the presentation with the idea that perhaps what we have already started could be incorporated into your own campaigns for breast cancer prevention. We are an NGO with a relatively small budget, and we have put together this campaign over the last 4 years. On October 15th, we are now in our 5th year. All the campaign materials are available at www.breasthealthday.org, and they could be used by other organizations and entities to support prevention campaigns in your country. Europa Donna is, of course, set up over the last 15 years to primarily ensure that all European women have access to accurate information and quality screening, diagnosis, and treatment. And we now have groups in 46 member countries across Europe. Many of us have had breast cancer. I myself have had it twice. Most of our board members are breast cancer survivors, and many of our members are survivors. What we saw and what you already know is that prevention also needs to be an absolute priority. And so when studies from the IARC made it evidence-based that indeed almost 1/3 of all breast cancer can also be prevented through lifestyle changes, we added prevention and the Breast Health Day campaign to one of our main priorities as a breast cancer coalition. So why did we do that? Let's talk a little bit about the numbers that we're actually speaking of. And I think it's quite appalling when you actually look here that there are 450,000 new cases of breast cancer annually in Europe. That would mean that by the year 2020, there will be 3,600,000 new cases. If 1/3 of those could be prevented, 1,200,000 women would not be getting breast cancer only through changing lifestyle changes. And what we have to recognize is that some of the risk factors connected to breast cancer are not going to change, as we saw this morning. Lifestyles have changed in the Western world. Women are having their children later. They're not breastfeeding for as many years. So some of the protective factors we are not going to see. What we have to do is make sure we do the other lifestyle changes that could make the difference in terms of this 1/3. So we launched this campaign primarily for the lifestyle factors to support those, to basically promote those in terms of physical activity, maintaining a normal body weight, and maintaining good nutrition and avoidance of alcohol intake. In 2008, we started it by launching the website, by holding a press conference, and by basically beginning to educate the women in our own organization about the importance of these lifestyle factors. I think the amazing thing about this is how few people know that these very simple changes in their lifestyle can have an impact on breast cancer diagnosis later in life. In 2009, we increased this by having a big public relations campaign. We used Arantxa Sanchez Vicario. We asked her to be a testimonial as a well-known tennis star to come and talk to women about the importance of physical exercise in avoiding a breast cancer diagnosis later in life. And we also launched a pamphlet and various activities in all of our member countries. So the idea behind this was to educate people, to get press notice of this information across many countries, and we also started with an e-card campaign which could be shared across many countries. In 2010, we took this a step further, recognizing that social media and the digital campaign was the way to go in terms of trying to reach lots of women in a younger category than we would normally be talking to as a breast cancer coalition. We also posted some videos on YouTube with information from epidemiologist Carla Lavecchia. We also had a t-shirt campaign. We redid the website, and we began to really try to use Facebook and Twitter and YouTube to communicate our messages. So through Twitter, we actually had a global reach of 153,630 who were tweeting about these lifestyle changes and things that should happen. 4,000 visits to our Breast Health Day website from over 74 countries, and over 400 viewings of our BHD video from the website. At that time, we also introduced a video that was sort of an interactive video game so that people could really participate and go online, and it would have an interest to younger women and women in the age groups we were looking at. We discovered that, in fact, we were reaching the right audience. The women between ages 20 and 35, 20 and 40 were beginning to see these messages, and not just the women that we might have normally been addressing through our breast cancer prevention campaigns. So in 2011, we made this a Make Healthy Choices campaign with new pamphlets and new materials on this topic. And we used infographics to inform people about the statistics on the website. And at the end, everyone who saw the video or who participated was able to upload their pictures, so that on the 15th of October, all of the pictures of people who were interested would appear in the last scene on the video. We also had an extensive online campaign last year because we recognized that this is absolutely the way to communicate with younger people and to communicate in an upbeat way these messages. Because let us remember, and I think it's been mentioned before, in trying to communicate with younger people, no one who's 16 or 20 years old wants to hear about breast cancer or the possibility that they could get it later in life. So we have to make the messages upbeat and positive in such a way that people will hear what they need to hear about the lifestyle changes they need to make, but not feel negatively about threats about breast cancer itself. So we found that in 2011 we had 1,000 Facebook users, and of course when you think that there are 500 million people on Facebook, this is a major opportunity, as we all know, that we have to use to reach younger people who are all using this, and I think something like 57% of them are women, so it's another area where we, particularly for breast cancer, need to work to get more people engaged online in hearing our messages and sharing these messages with other people. We had a global reach of 178,000 and more than 4,000 views of the video that I'm going to show you, which really talks about positive messages about Breast Health Day. We also, by this time, involved 28 of our national organizations in their own programs in their local countries. And I think this is an important message as well, that we have to get these messages also from the European level to all of our countries, who then would carry out their own Breast Health Day campaigns in their own way, in their own countries. And each year we go to the European Parliament and conduct a Breast Health Day information day there for parliamentarians as well. We have then involved ourselves in making sure that all of the activities that we're engaged in across Europe, that there is a Breast Health Day component, that these messages are conveyed at these conferences, whether it be the ECHO conference, our own Pan-European conference, the European Breast Cancer conferences, last year at the International Breast Cancer Prevention Conference in Rennes, and of course within the context of this partnership, the European Partnership Action Against Cancer, and all European patient and sponsor meetings. So we're constantly involved in continuing to, something happened. It's going backwards by itself. Sorry. Go forward. So, okay. There we go. So here are some of the national campaigns, because I think it's important to know that in every country people have taken this up, because many of you do come from health ministries where I think this could be taken up in a larger way within the context of major public health campaigns. And so on very small budgets, our local organizations did such things as in the Czech Republic, Swimming for Hope to raise awareness. In Slovenia, in the square, advising people on making healthy choices. In Cyprus, meeting fitness instructors and dietitians. And it's not going forward. Stuck on that one. Okay. So in Macedonia, there was picnic and, again, advice on healthy choices. In Sweden, there was Zumba and Bollywood dancing in the central station. In Stockholm, there was a stand in Finland. There was work on a symposium in Zagreb. Basically, in Paris as well, a conference on nutrition and prevention. National Health Day press conferences in Spain. Breast Health Day in Greece was an information booth throughout Athens with information on healthy lifestyle. In Ireland, we did walking and paddling, and the Minister of Health also participated in Breast Health Day. In Georgia, they also did some celebrating of Breast Health Day and used one of the organizations that does activities in gymnasiums. And of course, Breast Health Day in Turkey, they actually have a breast cancer awareness chorus that sings. It's still not going. Little, I don't. There's something wrong. Okay. And so as we move forward into 2012, we'll have a new campaign next year called Make Good Choices for Your Breast Health. But what we really do need, and we need your support and your involvement, we would like the WHO and the EU to declare the 15th of October Breast Health Day. So that's something that we can move on, and it's something that there are people in this room that can perhaps help us with. We'd like to be able to measure the impact more, which we don't have the facility to do at the current time. We'd like to involve others in the national prevention campaign, such as yourselves, and we'd like to add new research data. Now I get it. And finally, before I play the video, I'd like to say that what we also try to do is develop materials that can be used in all languages, that can be used in all countries, because we use very little actual language during the videos and during our various presentations. And last year what we did was to translate the final message into 20 languages so that the final message on the video is make healthy choices, but then could be used in all of our member countries. In addition, we use volunteers to make the video, so I think that basically we have managed to create some materials that could be useful to everyone, and as I say, that can be found on our website so that everyone can participate in Breast Health Day in the future. So with that, I'd like to play the video called Make Healthy Choices. And they're over. Thank you very much. Despite a few technical problems, you can see this on our website. We would like all of you to join us in making healthy choices and to join us in working on this campaign in the future.